Testosterone, essential for women.
If your libido is gone, take testosterone. If you can't even climax, take testosterone. If you have no sensation, fingers numb from masturbation, you might want to take some testosterone.
It's not just the hormone of virility for men, it's a vital hormone for women too. Loss of sexual desire.
If you have no desire, take testosterone.
Loss of clitoral sensitivity.
If you can't even come, take testosterone.
Ability to orgasm.
If you want to increase your power and pollinate your flower, you might want to take some testosterone. If you have no strength, take testosterone. If you have no focus, take testosterone. If you want to protect your organs, your heart, spleen, and shrinking clitoris, you might want to take some testosterone.
I will talk about this and more. 25% of menopausal women are experiencing hypoactive sexual desire disorder. It's considered an off-label use, which means it's not licensed for women. I've even applied a thin amount to my clitoris topically. When I rub the cream on my body, hair will sprout. Let's delve into testosterone. It's crucial to recognize that testosterone can decline with age. Women who do not have enough testosterone will suffer from hormonal imbalance symptoms such as a loss of sexual desire, a loss of clitoral sensitivity, and a loss of ability to orgasm, amongst other things. Studies have shown that testosterone can boost libido in women, and this is super important because as many as 25% of menopausal women are experiencing hypoactive sexual desire disorder, or HSDD for short.
If you're not in the mood, take testosterone.
So we know that around a quarter of women will probably really benefit from testosterone because the studies have shown that it can help. Testosterone can be prescribed to women experiencing reduced sexual desire, even while on hormone replacement therapy. To assess if you have a hormone imbalance with testosterone, a hormone specialist can offer a symptom questionnaire to assess the patient's libido amongst other symptoms and offer a trial of testosterone similar to how we approach other medications in medicine generally.
Hormones out of balance, take testosterone.
The doses of testosterone is minimal, aimed at replenishing what's lacking. It's available as a gel or a cream, and the gel forms are actually designed for men, as testosterone therapy for men is licensed, unlike for women. When prescribed to women, it's considered an off-label use, which means it's not licensed for women, but is still considered safe. Many medications are prescribed off-label and remain regulated products. It's unfortunate that women are currently unable to easily access a hormone so essential to their well-being and hormone balance. If you're going to use a bioidentical preparation from a compounding pharmacy, make sure it's a reputable compounding pharmacy. I've heard some bioidentical preparations can be unpredictable in their composition. I get mine from a reputable pharmacy that my hormone specialist has been using for years and for all of his hormone patients. So the testosterone I use is a clear gel. And I'm just going to put a little bit here on my hand to show you. And you can apply that to your inner forearms, and I just rub it in like that, abdomen area or upper thighs. I started using about half pump daily and found it was not enough, and my tests indicated this as well. So with the guidance of my hormone specialist, I've upped this to 1 pump, and I've even apply a thin amount to my clitoris topically, and this was recommended to me by my specialist.
If you want liberation and you're full of frustration, you might want to take some testosterone.
Reduced clitoral sensation can be caused by a variety of factors, and low testosterone is one potential cause. So if you rule out the other factors like hormonal changes during menopause, pregnancy, or other conditions, use of certain medications such as antidepressants or hormonal contraceptives, neurological conditions, psychological factors like stress, anxiety, or relationship issues, physical factors like decreased blood flow, or even gynecological issues, it may be a testosterone deficiency. And you can give this hack a try. Do not buy your testosterone online or without proper medical guidance. It's also vital to ensure that there's no other underlying cause for your symptoms and to be monitored correctly to find the appropriate HRT dose and type.
If you're feeling quite depressed, take testosterone.
When using testosterone, monitoring levels over time is essential, typically including semi-annual checkups of testosterone levels and the sex hormone binding globulin, or SHBG, to calculate the free androgen index, which ensures that it falls in the female range. Consulting with a professional experienced in testosterone prescription is key. I personally have been measuring my hormones every 6 months since my early 50s. Clinical data indicates that women who start topping up their testosterone not only experience improved libido, but also report enhanced mood, energy, concentration, stamina, and sleep, as well as reduced muscle and joint pain. This isn't surprising given testosterone's role as a biologically active hormone affecting various body functions, including brain health.
If you can't deal with the stress, take testosterone.
I'm going to briefly list the benefits of testosterone. Actually, there are so many. Did you know that testosterone can protect the heart and arteries and reduce the risk of heart disease? Did you know it can counter high cholesterol and angina? It protects the kidneys, pancreas, and digestive organs. It prevents joint and muscle pain and osteoporosis. Testosterone builds muscle and increases muscle tone, preserves body mass, and reduces fat, including cellulite. Testosterone tightens and tones the skin, preventing dryness and small wrinkles. It keeps mucous membranes moist. It stimulates growth of hair. Testosterone increases your ability to withstand stress and reduces anxiety, depression, and excessive emotionality. It contributes to positive mood, and it provides energy and endurance and helps to boost confidence. In women, the adrenal glands and ovaries produce testosterone.
If you want more focus and protect from osteoporosis, you might want to take some testosterone.
I thought it was also interesting to mention that there has been a decline in testosterone levels in both men and women over the past 50 years. And this can be attributed to a combination of factors, including, as I mentioned earlier, the age-related hormonal changes. As women age, their bodies naturally produce less testosterone. This is part of the normal aging process and is especially evident during and after menopause. Modern lifestyle changes such as increased sedentary behavior, poor diet, alcohol consumption, and higher stress levels can impact hormone levels. Stress in particular can lead to increased cortisol production, which may negatively affect testosterone levels. Alcohol consumption can affect estrogen levels in women, and alcohol can increase the levels of estrogen in the blood, which is primarily due to its impact on the liver. And the liver is responsible for metabolizing estrogen, and alcohol consumption can impair this process, leading to increased estrogen levels, and high levels of estrogen can lead to an increase in sex hormone binding globulin, or this SHBG, a protein that binds to sex hormones. And when SHBG levels are high, it binds more testosterone, making it less available for your body's use. And this reduces the amount of free or active testosterone. Exposure to endocrine disrupting chemicals, or EDCs, found in various products such as plastics, pesticides, and personal care products can interfere with hormone production and regulation. It's also important because women use so many topical beauty products that are full of these chemicals compared to men. The statistic I read was women can use 5 to 15 beauty products daily, whereas men use only 3, maybe 5. Decline in testosterone can also be attributed to health conditions and medicines. Certain health conditions like polycystic ovarian syndrome, PCOS, can affect testosterone levels. Additionally, some medications, including hormonal birth control, can influence testosterone production. Nutrient deficiencies, particularly in vitamins and minerals crucial for hormone production, like vitamin D, magnesium, and zinc, can impact testosterone levels. Higher levels of body fat can lead to increased production of estrogen and decreased testosterone levels due to the aromatization process in fat tissue. To recap, testosterone can be overlooked addressing hormonal imbalance. If you're experiencing any of the symptoms I've mentioned related to testosterone, please find a specialist who deals with hormone balance and have your testosterone levels assessed. Know your own body and be your own advocate if you feel like something is not right. I want to end with a short personal story where my fear of hormones played a part. I was prescribed a testosterone cream by an environmental specialist doctor in my early 30s because he tested and found that my testosterone levels were low. And when I mentioned this to my GP back in the day about this specialist doctor, my GP joked about when I rub the cream on my body, hair will sprout. I became afraid to use the low-level testosterone cream, and I stopped immediately. Years later in menopause, after so many years of research and living with low levels of testosterone, I decided to try the testosterone gel and have been using it for 1.5 years without any hair sprouting where I apply it. It's not a high dose that I use, but simply topping up the missing important hormone to achieve a hormone balance that will protect me in the long run, and it allows me to reclaim my sexuality. I want to stress that not all doctors are knowledgeable enough about the subtle hormone balance of a woman, and especially where testosterone is concerned. Actually, the same can be said for estrogen and progesterone. The anti-inflammatory benefits of low-dose top-ups of hormones far outweigh the health risks of the low levels and hormone imbalance. I hope you found this informative. Please like, share with someone who may benefit from this knowledge and information. And don't forget to subscribe to my channel.